What is the primary mechanism of action of digoxin? A. Inhibition of the sodium-potassium ATPase pump. B. Stimulation of beta-adrenergic receptors. C. Calcium channel blockade. D. Alpha-adrenergic receptor stimulation. The answer is A. Inhibition of the sodium-potassium ATPase pump. Digoxin inhibits the sodium-potassium ATPase pump in cardiac myocytes, leading to an increase in intracellular sodium. This reduces the activity of the sodium-calcium exchanger, causing an increase in intracellular calcium levels. Elevated calcium enhances myocardial contractility, making digoxin a positive inotropic agent. This mechanism is particularly beneficial in heart failure. In which condition is digoxin primarily indicated? A. Ventricular fibrillation. B. Heart failure with reduced ejection fraction, HFrEF. C. Myocardial infarction. D. Hypertension. The answer is B. Heart failure with reduced ejection fraction, HFrEF. Digoxin is used to improve symptoms and quality of life in patients with HFrEF, especially those with concomitant atrial fibrillation. It enhances cardiac output by increasing myocardial contractility and modulating autonomic tone. However, it does not reduce mortality in heart failure patients. What is the therapeutic range of digoxin in heart failure? A. 0.1 to 0.5 nanograms per milliliter. B. 0.5 to 2.0 nanograms per milliliter. C. 2.0 to 3.5 nanograms per milliliter. D. 3.5 to 5.0 nanograms per milliliter. The answer is B. 0.5 to 2.0 nanograms per milliliter. The therapeutic range for digoxin in heart failure is narrow, typically 0.5 to 2.0 nanograms per milliliter. Levels higher than this can result in toxicity, characterized by arrhythmias, gastrointestinal symptoms, and visual disturbances. Regular monitoring of plasma levels is critical due to its narrow therapeutic index. Which electrolyte imbalance increases the risk of digoxin toxicity? A. Hypercalcemia. B. Hypokalemia. C. Hypermagnesemia. D. Hyponatremia. The answer is B. Hypokalemia. Hypokalemia increases the risk of digoxin toxicity because potassium competes with digoxin for binding to the sodium-potassium ATPase pump. Low potassium levels lead to increased digoxin binding, enhancing its toxic effects. Monitoring and correction of potassium levels are essential in patients receiving digoxin. What is the most common cardiac side effect of digoxin toxicity? A. Atrial fibrillation. B. Ventricular tachycardia. C. Premature ventricular contractions, PVCs. D. Sinus bradycardia. The answer is C. Premature ventricular contractions, PVCs. PVCs are the most common arrhythmia associated with digoxin toxicity. Digoxin-induced toxicity can cause almost any type of arrhythmia, including bradyarrhythmias, tachyarrhythmias, and heart block. Close ECG monitoring is essential in symptomatic patients or those with elevated digoxin levels. What is the preferred treatment for life-threatening digoxin toxicity? A. Intravenous potassium. B. Magnesium sulfate. C. Digoxin-specific antibody fragments, Digibind. D. Activated charcoal. The answer is C. Digoxin-specific antibody fragments, Digibind. Digoxin-specific antibody fragments, Digibind, are the treatment of choice for severe digoxin toxicity, especially in cases with life-threatening arrhythmias, hyperkalemia, or significant CNS symptoms. These antibodies bind digoxin, rendering it inactive and facilitating its clearance. Which of the following drugs increases serum digoxin levels by reducing its renal clearance? A. Rifampin. B. Amiodarone. C. St. John's wort. D. Phenytoin. The answer is B. Amiodarone. Amiodarone inhibits P-glycoprotein and renal clearance of digoxin, leading to increased serum digoxin levels. Co-administration requires a 25 to 50% reduction in the digoxin dose to avoid toxicity. Other drugs that interact similarly include verapamil and quinidine. What is the effect of digoxin on the ECG? A. Prolonged QT interval. B. Shortened PR interval. C. Scooped, downsloping, ST segment depression. D. Peak T waves. The answer is C. Scooped, downsloping, ST segment depression. Digoxin causes a characteristic scooped appearance of the ST segment on the ECG, referred to as the digoxin effect. This is not indicative of toxicity but reflects its action on the myocardium. Toxicity, however, can cause various arrhythmias or other ECG changes.